pour ne rien vous cacher, on a un décès. Pour ne rien vous cacher, entre décembre et maintenant, nous avons déjà perdu 3 enfants âgés de moins de 12 ans. Et c'est le quotidien des associations qui n'ont pas d'allocation, n'ont pas de subvention et fonctionnent uniquement sur les dons dont elles bénéficient, mais aucune prise en charge pour l'instant du point de vue gouvernemental. Voilà ce que je peux dire. Merci beaucoup.
Okay. So to answer to Arafa's question on the Patricia just said, healthcare in Côte d'Ivoire comes a bit close to what she had earlier said. So in Côte d'Ivoire, there is no dedicated healthcare effort on the side of the government, and the only work that the government does is to try to bring associations to celebrate World LCD Day as a group. But the bulk of the SCD burden falls on the shoulders of associations. So they carry out several activities on healthcare, advice, providing support for patients and for persons living with sickle cell disease and their families, capacity building, negotiating on medication and blood transfusion, and many more. And the country has no specific SCD program, and there is no specific SCD plan of action. And their associations are working in a very limited space with very limited resources. She is a member and a leader of an association that has 150 members, and with all their efforts, they have just this year lost 3 kids to SCD, which is a very sad situation. And they have to practically fund the association, fund all the efforts that are being done. It is very strenuous, and I think Patricia is just raising the issue of lack of support on associations in Africa, in Côte d'Ivoire, and we are also seeing that in other parts of Africa. Thank you, Patricia. That's it for Patricia. Arafa.
Thank you, Anne Chantal. Thank you, Arafa.
Okay, for myself, Constant. Pardon. Merci. Pour ma part, c'est contrairement à la Côte d'Ivoire, le Bénin a un centre de lutte contre la drépanocytose pour les enfants. C'est-à-dire que tous les enfants qui souffrent de la drépanocytose ont un endroit où ils vont pour se faire soigner, ce qui n'est pas le cas pour les adultes. Concernant le ministère, comme on a dit, j'ai dit auparavant, il n'y a pas un plan défini de lutte contre la drépanocytose au Bénin, mais il y a plusieurs associations. Les associations jouent un rôle assez important dans ce domaine. Il y a plusieurs associations, au moins 3, mais ils ne font pas les actions ensemble. Il y en a qui font des actions sur la transfusion sanguine, il y en a qui vont profiter pour faire des événements, par exemple le 19 juin, mais les actions ne sont pas coordonnées. Et on reviendra là-dessus, puisque c'est l'un des buts de l'Alliance, c'est de coordonner les choses non seulement au sein d'un pays, mais au sein de l'Afrique. On en reviendra. Donc voilà ce que je peux dire. Le Bénin a un centre dédié pour le soin des enfants drépanocytaires. Pour les adultes, il n'y a encore rien. Et donc, il y a beaucoup de choses à faire sur le terrain. Merci beaucoup. Merci, Anne Chantal, pour la traduction.
Thank you very much. Merci, Constant. Thank you very much. Constant just explained that the situation in Benin is a bit close to the case in Côte d'Ivoire, but for the fact that in Benin there is an STD center that is dedicated just for children, so adults cannot go there. So there is a center for children, but there's none for adults. But like Côte d'Ivoire, there is no dedicated health plan or program that is for sickle cell disease. And the bulk of the efforts are also done by groups and associations of persons living with sickle cell disease or those affected by it. But the problem is that their actions or their work is not coordinated because each of the association does work on a different field. So some are focusing on healthcare, some are focusing on psychological support, and so on and so forth. And he is saying that, and that's where the African Sickle Cell Alliance comes in because it is one of the objectives of the alliance to bring groups together so that there is coordinated action in what SCD associations and groups are doing in across Africa to bring all of the groups so that the actions are not just mere trickles happening isolated, but they are brought together so that the impact or the outcome can be bigger and felt by a majority of persons living with SCD across the continent. That's a bit of what roundup of what Dr. Vodoué said. Arasa?
Thank you.
No.
Thank you so much, Chantal. Can we hear from your side?
Okay, so in Cameroon, it's a bit similar. Like Benin, we have in Cameroon it's not really like a center, but I'll say it's a hospital ward. So there are a few hospitals in Cameroon when it comes to clinical management of sickle cell disease. There are a few hospitals in Cameroon that have wards, they're not really centers, but that have wards that are dedicated to sickle cell disease. And there is one in particular, which is a hospital owned by the First Lady of the country. But that one targets just young people, children, I think from 0 to I think about 14, 15-ish, that takes care of children. And then the other hospitals are more open, adults and children alike. The issue is that because of the centralized system of government in Cameroon, a lot of these efforts are targeted just in two regions, or two places actually, two cities, the capital and the economic capital. So that means the rest of the thousands of warriors spread across the country don't get access to the services that are there. And if they have to they have to travel very long, using very, very bad road infrastructure to get to these hospitals. And it's also expensive. So associations there, in my knowledge, the association life, if I can use that, just started growing in somehow, let me say, in the late mid 2000s, and now it's a piece of speed. But before, even in associations were very rare. And even now, I think the associations, even though they are there, they don't have that visibility. So it makes that a lot of the warriors don't really know where to find these associations, don't really know where to go to get in touch with these associations. Except if you go to hospital and then you stumble across somebody from the association. Government-wide, SCD programs, apart from the one that they had in 2015 that was funded by the Fondation Pierre Fabre and the French Development Agency and other international partners. I have not heard of others. With the Cameroonian system is that information is shrouded, so one doesn't know what is happening in the country. There's a lot of lack of research, and there's a lot of lack of dissemination of information around SCD, not just SCD, but around a lot of things, including SCD. There is normally supposed to be a department at the Ministry of Public Health that focuses on rare diseases. But before I left Cameroon 2 years ago, I tried to get in touch with whoever is responsible, but it never worked. So one would not know exactly what that department does and how far their work is gone. In Cameroon, but recently associations are doing a lot of work. They're doing work on providing basic medication for warriors, especially now with Cameroon in a tight security situation coming with Boko Haram in the northern part the ongoing Anglophone crisis that has displaced thousands of people, including warriors. Associations are trying to reach out to them to provide medication, but now also they're also trying to reach out to them just to provide basic care, clothing, feeding, because these are people who are displaced. They don't know again where to go to for hospital. Their normal checkups is shifted and shambled up because they don't. Where some of them are sleeping in the bushes. So associations are doing a lot of work now, but all of that just started recently, and I hope it's going to grow. Thank you, Arifa.
Thank you so much, Anne Chantal. Um, I would speak on my perspective. First, I would like to congratulate my country and my Ministry of Health because as Tanzania has strengthened services of sickle cell disease and is finalizing the establishment of 10, 10 specialized centers at referral and regional hospital and regionals where there is high burden of the disease, which will provide specialized health services for sickle cell disease. And Tanzania has developed the 2016 to 2020 NCD strategy that for the first time included sickle cell as one of the priority conditions. And also Tanzania has included sickle cell disease in the standard treatment guideline and increased access to disease modifying medicines such as hydroxyurea. So there's a lot of things that it has been doing, but also Tanzania has one of the largest single center clinical research program for sickle cell in the world, providing a platform for both biomedical research and optimal healthcare. And this has assisted Tanzania to be a key country in major health and research networks and consorts, which include Sickle in Africa, Sickle Gen Africa, H3 Bionet, REDEC, Global Sickle Cell Disease Network, ASH Newborn Screening Initiatives. And in 2017, sickle cell health passports were introduced to patients so that records of their health can be documented. The health passports are also part of strategy to establish a registry of sickle cell disease patients. I think I can stop there, and I see Aliyu and Isaac are back. Would you like to continue with us, or should I just continue? Aliyu?
Yes, hello, Arafa.
Yes, welcome, Aliyu. We are talking on explaining the clinical management of sickle cell and involvement of Ministry of Health in the care plan for the warriors. Welcome.
Okay, thank you very much. And then good afternoon from the Gambia. My name is Ali Sambo. I'm the interim vice president of the Africa Sickle Cell Alliance. Here in the Gambia, we have three major hospitals where the patients can get access to medical care. But actually, the main hospital, that is the Edward Francis Small Teaching Hospital, that is the major hospital in the capital of the Gambia, in Banjul. Now, with the help of the Ministry of Health, we have a clinical day that is on Wednesday for sickle cell patients, because in the Gambia here, sickle cell is one of the largest clinics in the Gambia, with over 500 patients that go through the clinics every time. So it's one of the largest clinics in the Gambia. So therefore, the government decided to choose Wednesdays to be sickle cell clinical day in the major hospital. And now they are trying to move that across all the major hospitals in the Gambia, so that on Wednesdays, patients can go to this hospital and then be checked and then be treated and then be given medication. So definitely, we've been working very close with the Ministry of Health because we are the only sickle cell association in the Gambia that is recognized. I know now we have some few other ones that are growing up, but we've been here for 13 years, and then we've been working with the Minister of Health, with the Minister of Education, Minister of Social Welfare, and then other partners around the country. So with that um, collaboration, we've been able to have so many things. So therefore, in the Gambia, despite the fact that we don't have specific data on how many patients are affected, but yet still our association and the government have been working hand in glove to make sure that we try to initiate and bring up some initiatives that are missing in the health sector, for especially for sickle cell patients. So therefore, a lot has been done, even though it's a small country with less resources, but we've been trying, the government has been trying to work hand in glove with us because they are our only partners. And then we are the only sickle cell association. Therefore, with this relationship, we've been able to achieve a lot. We have not yet gone too far because sickle cell is not um, that much considered, but at least with us, with our advocacy work and with our connection with the ministry, we've been able to have this. So far, management in the Gambia, that is how it is so far. Apart from that, we also do advocate and try to help patients on how to manage their sickle cell issue. So far, that is how things are in the Gambia. Thank you. Hello, Arafan.
Thank you so much, Aliu. I thought Isaac was back, but I see he's still having problem with his mic. So that was Aliu from the Gambia. We'll go back to Patricia and Constant, and our question is: what are the achievements registered in sickle cell disease fraternity in your country? And please share your wishes for sickle cell disease in Africa. Welcome.
Okay, thank you, Alpha. Thank you so much. Merci pour ces deux dernières questions qui, en réalité, vont plutôt nous permettre de mettre l'accent, parce que les précédentes, déjà, ont fait un état des lieux de la situation. Aujourd'hui, je pense qu'on va vraiment aller sur les perspectives, parce que en termes de réalisation, en dehors des quelques rassemblements, des quelques actions de sensibilisation, de dons de sang, et on ne peut pas véritablement dire qu'aujourd'hui, les réalisations sont significatives en Côte d'Ivoire. Mais par contre, les besoins, la vision, elle, est beaucoup plus grande. Et donc, je souhaiterais plutôt, vu les quelques minutes qui nous restent, me concentrer sur les perspectives pour mettre l'accent sur la sensibilisation en langue locale. Aujourd'hui, en dehors des grandes villes, nous avons nos campagnes. La drépanocytose touche environ 12% de la population ivoirienne et tout le monde ne comprend pas le français ou les langues nationales. Et il serait beaucoup plus intéressant aujourd'hui de penser à sensibiliser en langue locale pour que la sensibilisation touche le plus grand monde. Il y a également la question des textes. Aujourd'hui, les tests prénuptiaux et les tests avant le mariage ne sont pas obligatoires. Donc, ça veut dire que quand vous naissez en Côte d'Ivoire, quand vous vous mariez en Côte d'Ivoire, vous ne savez pas si vous êtes drépanocytaire ou pas. Les tests ne sont obligatoires que pour les femmes enceintes. Il y a aussi la question de la création de centres de prise en charge de la maladie par région, comme ça se fait déjà en Tanzanie. Et je félicite la Tanzanie véritablement pour les efforts qui ont été faits et également la Gambie et aussi le Bénin pour au moins les initiatives qui sont menées. Mais en Côte d'Ivoire, nos besoins sont encore très importants. Il faudrait envisager aujourd'hui d'avoir des centres médicaux par région, ce que nous n'avons pas. On pense aussi à des allocations qui seraient faites par le gouvernement pour la recherche, pour que la recherche aussi sur la drépanocytose en Côte d'Ivoire soit une priorité et qu'on puisse également... Donc, voilà, pour avancer rapidement, il y a les questions aussi du coût d'accès aux médicaments qui doit être revu, la question des mesures incitatives pour l'insertion professionnelle et l'octroi de bourses d'études aux enfants drépanocytaires, l'éducation, la formation des populations dès l'école avec l'intégration de la drépanocytose dans les programmes scolaires, la formation du personnel soignant, la, la, la mise en place de protocoles de prise en charge de la douleur. La liste est tellement longue, je ne voudrais pas mobiliser le peu de temps qui nous reste pour vous dire que vraiment, les besoins sont importants, la vision est grande et à ce stade, le combat, c'est vraiment un plaidoyer que nous allons rédiger en tant qu'association pour pouvoir nous rapprocher de nos gouvernants pour que la drépanocytose devienne une priorité de santé publique avec un programme de santé publique qui pourra intégrer toutes ces préoccupations. Je vous remercie.
Merci, Patricia. Thank you very much, Patricia. So, Patricia just spoke. Sorry, I hope everybody's getting me. Is everybody getting me? Sorry,
Yes,
my
yes,
internet is
yes.
okay. Thank you very much. So, Patricia just said she thanked Tarafa for the last two questions, the previous questions, which was more on having an idea on what is the STD situation in Cote d'Ivoire, and the way forward for her is more important and it's bigger because that is the avenue or where efforts can be done now or present in the present. And some of the areas she pointed out include, she says that there is a huge lack of sensitization in Code 1, which is an area which she hopes something done in it. Sensitization in local languages, especially 20% of the population in Cote d'Ivoire is affected by SCD, but not everyone in Cote d'Ivoire speaks French. There are other local traditional languages, and having SCD information in these languages will go a long way in raising awareness on SCD in the different communities, different target populations of people who do not speak French. She also raised the point of making prenuptial tests and STD tests for pregnant women compulsory, which is not something that exists in Cote d'Ivoire. And so there are still marriages going on in Cote d'Ivoire with people who are affected by STD and who do not even know their STD status. She also raised the point of, she congratulated Tanzania, Gambia, and Benin for the work done, which they have done. And she says Cote d'Ivoire is also in dire need of health centers that would be based at the level of regions, because it ensures that communities based in different regions can easily go to these centers instead of trying to crisscross the country looking for where to get medical services. And she also raised the need for research and support on research, need for education on STD. She raised the lack of capacity building for associations as well as for health services. She also raised the need for finances to support work going on to raise awareness on STD, to develop activities around and projects and programs around STDs that would benefit people. And she says her association is really aiming to work on an advocacy to present to the authorities so that see how these things can go forward, such that persons living with STDs in Cote d'Ivoire would at least benefit from a cross section of these services, which is what's really lacking in the country. Patricia, I hope I got it all right. Hello.
Sorry. I told you that you get it, and it was not easy, so congratulations.
Thank you. So
you did well. Thank you.
So I refer that Patricia.
Isaac. Isaac.
Okay.
Okay, thank
Yes,
you so much.
can you hear me now?
Yes, we can hear you.
Yes, thank you so much. I'm sorry for the challenges of actually faced the last, I should say, I don't know, 15 minutes. I've really missed a lot. I don't know whether you can hear me now.
Yes, we can hear you, Isaac. Go ahead.
Yeah, thank you so much, Arafa, for taking us through as our moderator. I'll come in now and moderate for the remaining minutes. And I want to appreciate everyone for the participation, active participation, and contribution towards management of sickle cell in different parts of Africa. We've had a panelist from Cameroon, we've had a panelist from Tanzania, from Cote d'Ivoire. Thank you so much, Patricia. And now, I want to toss this to Anshatel. What are the achievements registered in sickle cell fraternity country? And can you please share with us your wishes for sickle cell in Africa or in your country per se?
Okay, so thank you very much, Isaac. So in Cameroon, if I was talk of achievements, I would really, really like to give a thumbs up to sickle cell advocates who have, I'll say, single-handedly carried the burden of SCD in Cameroon. So we have somebody whose mic is open. Maybe we should have those who are not talking just put themselves on mute for a bit. Thank you very much. So I'd really like to congratulate advocates in Cameroon because they have really taken up the SCD battle, if I can use that term. Because before it was like dead zone. You go to the side of the ministries, there is not much information, and warriors didn't know what to do. I'll take my case personally. My parents had to, get information from Nigeria, from a professor from the University of Stuttgart. Nigeria because of the lack of information trickling from the ministry. And so I want to say one big achievement is the advocacy that's going on. Warriors have decided to come out of the dark and to speak, and that is what we need. People need to speak, people need to share the experiences. And if I would say a wish, my wish is to see all these efforts. They are laudable, they are super, they are beautiful. There's Are Echi who's doing great work. There are other advocates who are not warriors. There are people like Dr. Michael Budzi, who is not a warrior, but he's so active into SCD awareness raising and education and sensitization in Cameroon. There are so many organizations which were created by warriors that are there. And what I would love to see is for them to work together, as one. I am a policy person. Before just recently I left the UK government as a policy person working for them, and I've seen what is done to bring about the application of foreign policy in Africa. What happens is when one country can't get its policy as agreed by an African government, what they do is they bring in the other country to support them. So France would bring in Germany and the UK and Belgium and this, and they'll come as a bloc. We need that bloc in Cameroon among the warrior and let me say the SCD community. We need that bloc. We need to bring the doctors, the warriors, the trade persons, the caregivers, all of us, so that we can have that voice. I think it's only in having that voice that we can bring that pressure on our government to finally consider sickle cell disease as a public health priority and to be able to be there and have a voice even when they are drafting those laws. We don't have that, and that's my biggest wish, to have associations come in that block. And my second wish is to see sickle cell disease in Cameroon in the classroom. I was taught how to dissect a frog in primary school. I tell you, I don't know what that benefited me now. But if I was taught on sickle cell disease, it may be like a topic in my biology class, I'm sure I would have known that sometimes there are some errors that I may have done with my health that I would have known how to deal with it better. So that's what I have to say. Thank you very much. Hello, Isaac. Hello.
Hello, can you hear me now?
Yes,
Can you hear
yes.
me? Yes.
I hope everybody heard me, and that.
Yes. Thank you so much, and Chantel. I would love to request for more minutes, if at all. Maureen, you have more time for us to proceed and have everyone sum up with the last question I had just posed. Maureen, do I have? I'm requesting for more.
He said we have only 2 minutes. I don't know.
I can go ahead.
Just 2 minutes. You still have 2 minutes.
Okay. Okay. Thank you so much. Thank you so much for that time given. I'm going to request the rest of the panelists to give us their view as per the question. I'm going to read the question again. Aliyu, thank you so much for representing Africa, particularly from Gambia. I want you to share with us the achievement registered in sickle cell in your country, and also share with us your wishes for sickle cell in Africa at large and your country per se. Thank you.
Thank you very much, Isaac. I don't think I have to say much because from what AC has just said, we all have the same wish as warriors. What we want is to have a better self-care facility with laws put in place in all African countries that will protect warriors from being stigmatized and then being discriminated. So basically what we want is just a better self-care facility for all sickle cell warriors. So that we'll have access to them easily and to have a better life as warriors. So basically, that is my wish as a Gambian, as a warrior, and as an African to have a better healthcare facility for all sickle cell warriors that is accessible and affordable, and then also to advocate more for sickle cell warriors, and then to have laws put in place in all countries that will protect warriors from being discriminated and then being stigmatized. Thank you. Isaac?
I think I can just go. Thank you.
Thank you.
Our time is really going, so I'll just jump in and bring my concerns. As I think we have spoken a lot, and I would really like to go on and share my wishes for sickle cell in Africa first. I think I know that we need more education and awareness. Advocates community needs to be empowered in terms of financial resources and international recognition. And in African countries, 100% government involvement is needed, as in better health policies which will benefit the sickle cell patient, affordable quality healthcare services, and more information and data on sickle cell disease. And we need to, we as Africans, we need to have a formal recognized Sickle Cell Africa platform where every member of the sickle cell community can voice out their concern and be helped. As we are all working towards ending the sickle cell cycle, so we need to keep on advocating and advocate. Thank you so much, Isaac.
Yes.
Thank you very much. This is all we can take for now. If you still need to respond to the questions, you can do so while everyone can join the next session. The Q&A session is still open. You can respond to the questions there as text so that people who come after the session can see responses to the questions and also as they view the replay of the session. So thank you very much. You can join us in the next session now.
Thank you very much.
Thank you so much, Maureen.
Maureen. Thank you. Thank you, Constance. Thank you, Patricia. Rafa, Aliu, Isaac.
Thank you, everyone. Thank you, everyone. Bye-bye.
Bye.
Bye.